Hello, Tech Talkers. Welcome to our latest webinar for 2025. Can you believe it? This is the last one for the year. For those that are new to our series, I'm Janine Bennett, Assistant Secretary for Digital Business and Sector Engagement Branch in the department and the Engagement Lead for the department's Digital Transformation Program. I'll be your moderator for today's webinar, and I'm so glad to be back here with you, particularly given this is our first webinar since the New Aged Care Act went live on 1 November, and because this is our chance to wrap up what's been an absolutely mammoth year for digital and operational transformation for all of us that work in the aged care sector. Today, I'm joining you from Ngunnawal and Ngambri lands. I want to acknowledge these traditional custodians and pay my respects to elders past, present and emerging. I also want to extend that respect to any Aboriginal and Torres Strait Islander people joining us today. As always, it's an honour to have you with us. A few quick housekeeping notes. If you have connection issues during the session, there's dial-in details on your screen and also in your meeting invite. As always, today's webinar will be recorded. We'll upload that recording to our website and to YouTube so you can watch it again and share it with anyone who wasn't able to join us today. For anyone that is keen to take a walk down memory lane, keep in mind that all 28 of our events in this series can be viewed online at your pleasure. We know not everyone likes to use QR codes, but some people do like them, so we do tend to use them in our decks. All of the QR codes that we show during today's session will also have URL links included, and we'll post those in the Q&A space. So if you want to access a URL link instead of a QR code, just go to the Q&A tab and you'll be able to copy those links for future use. Also, we'll email the links out to you by the end of the week, so you'll have them in that email as well. Speaking of Q&A, like always, we have 30 minutes at the end of today's webinar set aside for your questions. Don't wait until then to get your questions in. You can type them in the Q&A tab at any time during our session and we'll queue them up for answering by our panel. You can find the Q&A tab at the top of your Teams window. Remember, if you see a question you like, vote it up. That's also available from the Q&A tab. Keep in mind, our Tech Talk is about our technology and delivery work. We'll do our best to answer any and all questions you put to us, but generally our focus stays on those areas. As always, we'll try and get through as many questions as we can, but if we don't get a response in session to your question, please know that they aren't being ignored. We are capturing them. We'll answer as many questions as we can in the room, but we suggest for highly specific and detailed questions related to your individual circumstances, it's super helpful if you can include your name so that our team can get in contact with you and we can get you the right answer for the problem that's presenting for you. For more general questions, we analyse all of them. We send them directly to the relevant business areas. In these cases, our business colleagues use those questions and input to update existing resources like our Support at Home program manual, or to develop new resources that the sector needs, and these often will be added to things like FAQs. Where we can, and for people who've been to previous Tech Talks, you'll know we also like to come back with our very popular questions at future events just to make sure that you've seen the answers to those. And we do also use your questions to develop suitably timed agenda items for our future Tech Talks. So if we can see a lot of people are interested in the subject, we make sure and try and build that into a future agenda for you. For any media representatives joining us today, welcome and thanks for your ongoing interest in this important transformation work that's happening in aged care. Great to have you with us. Just a reminder that for any media related questions, remember to direct those to our media and events team. That's at news@health.gov.au. Those folks are best placed to help you with those media related questions. Okay, as mentioned, today is our first Tech Talk post the major 1 November milestone. And for that reason, we've focused our agenda on what's been achieved to date, with also some information about what's still to come. Our regular attendees will notice that phase update has been moved to the end of the webinar. As this is the last event for the year, we wanted to give her some space to wrap up and do a bit of a year in review. So our first agenda item today will be from Maria Fildaro, who's here to provide an aged care reform update. That's followed up closely by Brian Schumacher, who we're welcoming back. Who'll give an update on the systems enhancements delivered to support the new Aged Care Act. And then we also welcome our colleagues from Services Australia, Kathy Volkert and Catherine Veitch, who will take us through the deployment and integration of the Services Australia payment system. And then we'll hand over to Faye, who'll give us the digital transformation year in review, and we'll wrap up with a half hour of Q&A, presuming our timing sticks to plan. Okay, so that's what we're doing today. I'd like to introduce our host. This is Faye Flavaris, our CDIO at the Department of Health, Disability and Ageing. Regulars will be very familiar with Faye. She is a valiant advocate for digital transformation and digital maturity in government, aged care, disability and health. She's the senior executive lead for the department's digital and IT divisions that are driving digital strategy and investment, digital transformation and digital delivery, all things digital. Faye, welcome and over to you.
Thanks, Janine. And before I introduce our speakers, I also want to acknowledge that unless you've been under a rock, everyone knows the Aged Care Act 2024 came into effect as planned on the 1st of November. And it's the culmination of the efforts and collaboration of many people. You've all been part of this process. We thank you for your patience, your investments, your perseverance, and really, your frank feedback and fearless feedback. We've made this once in a generation change together. Huge thank you to my own team in the department and our partner agencies, Services Australia, the Australian Quality Safety Commission, your willingness to work in partnership with us and the sector and to come along to this forum, and our sector partner group so many times is so appreciated. I also wanted to give a shout out to all the SMEs who have taken the time to lend their expertise. There's a lot of people behind the scenes that help, who are on standby to answer questions and in the lead up to the sessions to make these tech talks what they are. Whilst this isn't the end of the reform journey, it has been a huge achievement for all of us, you in the sector, providers, software vendors, all of you, to get to this achievement. And I think it's really important we just stop and reflect on what we've achieved together. So today I want to acknowledge everyone for all you've achieved together, and let our speakers take you through the details of some of the major things that we accomplished. So first up, we have Maria to stage. I'd like to welcome Maria Filato to the Tech Talk. I think it might be her first time, if I'm not mistaken. Maybe not. I forget who we've had. Maria is an acting assistant secretary in the Department for the Reform Implementation Division. This division worked alongside us and directs and supports the implementation of ageing and aged care reforms, including the Royal Commission into Aged Care Quality Safety Commission recommendations, like all of them. So Maria will take us through some of the highlights from the 1st of November reform implementation. So over to you, Maria.
Thanks so much, Faye, and thanks for inviting me today. It's a pleasure to join you all. As Faye mentioned, I'm Maria Filato, Acting Assistant Secretary of the new Aged Care Act Transition Branch. To echo Faye's comments, the start of the Aged Care Act puts older people at the centre of aged care and delivers a high quality, respectful and sustainable system. The Act also underpins responses to 58 Royal Commission recommendations, such a massive, massive achievement. And that includes a Statement of Rights for Older People, the Australian Government's response to the Aged Care Taskforce recommendations, the new Support at Home program, of course, strengthened aged care quality standards and stronger powers for the Aged Care Quality and Safety Commission, amongst many other reforms. This significant achievement is the result of working closely with the sector on the design and delivery of aged care reforms for several years to ensure successful implementation. And just echoing those comments on the partnership having been so critical to that success as well. So from a sector perspective, which is the lens that I'm taking today, we recognise that this is a significant change, and we've been engaging, listening and collaborating in the development of the legislation, the sector change and communication support, as well as the staged digital delivery. So no doubt you're probably aware of our sector change plan, which outlines the communication, engagement, guidance and training activities that have been made available across the department, the Aged Care Quality and Safety Commission and Services Australia to support older people to understand what to expect, workers to enable the practical delivery of a rights-based model of care, and providers with detailed guidance on how to adjust their operations and processes. The department has led extensive engagement with the sector through webinars like this one, face-to-face events and sector forums. There's also been regular updates across the department's newsletters, websites and social media channels. Resources include program manuals, information booklets, transition guides, fact sheets, frequently asked questions, webinars and videos across various reform topics. So you can find a whole host of our resources from the New Aged Care Act in Practice page on the department's website. It was previously called the Prepare for the New Aged Care Act, but if you search on that, either the old name or the new, you will still find all those resources there. Just to outline a couple of the resources that are there as you continue to make your way through the transition. What we have, if I can just highlight a couple for you, the priority actions list. That's there for providers to be, it really consolidates in the one place what providers need to do across all the guidance materials. And that's from the Department, the Commission and Services Australia, and it links to all the detailed information. So it helps providers make sense of what's relevant to them, and it segments which actions are for which type of provider. It has been downloaded over 12,500 times, and providers have told us that they're using it for as their overarching checklist. So do check it out if you haven't already. In terms of understanding the Act a bit more, we have published the Guide to Aged Care Law on the department's website as well. That brings together the New Aged Care Act, the Aged Care Rules and the explanatory memorandum in an easy to use format. It condenses what's really over 2,000 pages of legislation into a clear 120 pages, and it's searchable. It mirrors the format of the Act, making it easy to look up the actual references if you want more detail as well. There's been a range of materials for the Support at Home program, as you know, including the program manual, the Support at Home provider transition guide, and the Support at Home finalising home care package claims and commencing claims for Support at Home. Along with a whole host across all of our reforms of booklets, fact sheets, FAQs, webinars, videos, in particular for organisations, downloadable resources on the Statement of Rights, and materials across all the reforms, including the digital changes of which you guys are definitely across. Just to also highlight as well, on an education and training front, the department and the Aged Care Quality and Safety Commission have also developed a suite of training materials, tailored e-learning modules on the New Aged Care Act, the Support at Home program, and the Commission has also got information and modules on regulatory and practice guidance, as well as the strength and quality standards. So training modules can be accessed from the Commission's online learning platform, Alice, and modules can also be downloaded from Alice as well as from the department's website for providers to incorporate them into their own learning management systems and training programs. So we are actively promoting those modules as well as monitoring the engagement and completion rates across all of our materials. I really encourage you to have a look. You can also subscribe to our aged care newsletters where we provide updates and information weekly, and we can pop the link or send that out to you as well. So in the lead up to 1 November, we updated web content, including updates to publications, which went live on the department's website on the 31st of October and on the My Aged Care website on the 1st of November. The department has also published news items on both websites, posted on all the department's social channels, and sent out 41,000 subscribers an alert on the 1st of November as well. There was also a media release from the Minister in line with a press conference as well. But our work is not done, so we're continuing to support transition. We continue to listen and respond to sector needs through regular engagements, such as forums like this, as well as through the Aged Care Transition Task Force, which remains in place through to February, the National Aged Care Advisory Committee and the Council of Elders, local engagement with older people and providers, and also targeted consultation with regional and rural providers, specialist First Nation providers and diverse audiences. So we are continuing to monitor adoption and we're actively listening, supporting and responding to feedback. And we'll continue to provide practical support and guidance to older people, providers and workers through the transition period and beyond. So I'll leave it there for now and look forward to your questions later in the session. Thank you, Faye.
Thank you very much, Maria. That's awesome. So next up, we have Brian Schumacher, who's our first Assistant Secretary of the Digital Transformation and Delivery Division. This is the division that was overseeing the delivery of the aged care ICT programs of work. So we'll find out how all the major releases went. Thanks for coming and joining us today, Brian. The floor is yours.
Excellent. Thanks, Faye. It's great to be back at Tech Talk. It's been a little while since I've come to one of these. But yeah, look, what a year it's been so far. A lot of milestones reached, a lot of collaboration across the sector. It's been great to be part of. I thought I'd start by drawing out some of the highlights from across the year that we've had in our digital transformation journey so far. As you can see, we kicked off the year strong with our first major release in February, which delivered key star rating enhancements, which include capability to support staffing calculations, and that was to align with the changes that were happening to care minutes. We also made some enhancements to the single assessment system, which were focused on streamlining processes, improved decision making, and to start to put the foundation changes, which would ultimately support the new legislative requirements under the Aged Care Act of 2024. And finally, within that release, we made some enhancements to our business to government capability, which were around the Quality Indicators API, and that was to support the new staffing indicator for allied health. Then going on to March, another successful release. Each one of these releases gradually got bigger and bigger, so we saw a lot of kind of focus on quality and that sort of thing coming out of the work that we were doing. These changes in the March release focused on some of the foundational support for the new Aged Care Act, in particular for GPMS, that focused on the transition from moving from approved provider to the register provider model. It was a key enabling piece that was done, which enabled the preview providers to preview their deeming outcomes, getting ready, essentially helping sector get ready for that change. And again, within that one, on our business government platform, we released our first beta APIs in alignment with the new Aged Care Act requirements. So what that did was allow early development, early visibility around some of the new data model changes that were coming through, and encourage that early adoption of the APIs to make things a bit more streamlined. Then most of you already know this one. The big one came in November. We had the deferral from July into November, which saw finally the capability release to support implementation of both the new Aged Care Act and Support at Home initiatives. I think it was probably the largest release the department's had for aged care in its history. To give you a sense of the size of how big that release was, normally we would deploy around 15 to 20 major changes per release. For this release, we delivered over 60 major changes. So significant in terms of size. There were over 25,000 test cases run across the platforms. So a lot of work went into making sure that that release went pretty successfully. In terms of the release itself, significant upgrades across all our systems were made to comply with the new Aged Care Act, which included structural changes, data migration, and some enhanced integration changes as well. So some of the key improvements that were made to our GPMS system, self-service capabilities, reporting, streamlined data sharing for compliance and payment. Then across the My Aged Care platforms, major changes include the foundational changes to launch the Support at Home program, the new priority system, and enhanced provider self-service. In addition to that, we also made improvements to support end-of-life and assistive technology pathways, some streamlined data sharing work with our partner agency with Services Australia, and then released some improved tools for referrals and supporter management. Lastly, our beta APIs were released into production, which included updates to align to the new Aged Care Act, and that will hopefully uptake begins pretty soon, and so we'll start to see smoother, more automated reporting processes through the APIs. All right, on to the next one. So as you know, once we've gone live in November, it's just the start of the journey. So we have a number of other releases planned throughout the remainder of the financial year. At this stage, we're looking towards that February and March timeframe for the next releases, which we're aiming to have a focus on things within GPMS like self-reporting, specialised status applications, regulatory decisions, care minutes, supplements, financial transparency, integration updates, operational reporting, and a number of enhancements to star ratings. For My Aged Care, we're looking to make further enhancements to support at home transition, urgent services updates, delegate work approval workflows, and some further updates to some of the data transmission fixes that we've got underway at the moment. In addition to those, the February and March releases, we're also planning out what further phases we do need to undertake. At this stage, they're likely to be around June and October. As the details of those start to firm up and emerge, our intention is to share them back with this group. So that's in terms of work that's underway, but I would like to take the opportunity to give a big shout out and a thanks to the sector and our providers and vendors. The advice you provided and the investment over these last few years, in particular preparing for the new Act, has been extremely valuable and helped us succeed. As you know, big digital transformation is always complex and difficult, but working together is something that has made that journey a whole lot easier. And finally, big thanks to both my colleagues across the department and also partner agencies for their collaboration and leadership through through the huge journey we've just gone on for reform. I think without that collaboration, we could have been in a lot worse position. So I think we're in a really good spot now. And it's a thanks for everyone's collaboration and input through that journey. So that's about it from me today. So back to you, Faye.
Thanks a lot, Brian. And there was a lot of hard work there. I could see the release momentum building up as you were describing it. So congratulations to you and the team. Now, next up, we've got Kathy and Catherine. Can I bring them up to stage, and we're going to get our Services Australia update, who've been an integral partner on this journey with us. So a pleasure to have you both today, and I'll hand over to you.
Thanks, Faye, and hi, everybody. In the flavour of the journey we've been on, I am going to focus this conversation a little bit on the journey we've been on so far and what our focus area is at the moment. But before I go into that, I just want to cover what Services Australia role has been in the reform before I cover what the journey has been. So our role in delivering the new Aged Care Act 2024 has included ensuring that older people's means are assessed and their contributions are set correctly and in alignment to the Act. Also helping older people experiencing financial hardship to get the support with their aged care costs. We also process subsidy and supplement payments to approved aged care providers and communicate with people about any changes to their aged care fees or contributions. A part of our role is to also support provider queries and care recipients, their families and nominees about Services Australia systems and processes. And we provide support for older people and their nominees through our specialist financial information service officers and aged care specialist officers that provide appointments for older people and their nominees. So the journey we've had has been quite lengthy as well, and we have got quite a few things on the slide. I'm not going to read them all word for word, but cover some key things. So we have successfully implemented our systems for implementation on the 1st of November, and we did originally have our aged care portal in read-only mode. We did move that out on 5th of November, and that was transitioned out of read-only for providers and our staff. And since that time, we have received home care package claims from providers, as well as a significant number of invoices from providers in preparation for their December claiming for support at home. So that's been really good to see, and has indicated that our APIs are working quite well, or also we've got providers using our other options, such as the CSV files and manually uploading through the portal. We also commenced the transition of people from home care support or care recipients to the new Support at Home program. So from the 6th of November, we started distributing letters to the cohort, and we've now completed the transition letters, and they have been issued to over 303,000 current care recipients. About 191,000 were via mail, and 112,000 of those were delivered via our MyGov inbox. And that's the choice of our care recipients about how they wish us to communicate with them. We've also been doing a lot of business verification testing, and that has included some testing with some software vendors. Some of you might actually be in this call, and that's been going really well. And over the last week, we have also tested the ability for the Support at Home claims to be lodged and paid through our systems, complete end to end, and they have all worked successfully. So that sets us up really well for our 1st December claiming for Support at Home at scale. So that's been really positive for us as well. We've also published comprehensive data in the eKit for Support at Home on our website, providing valuable suites of resources, specifications, simulations as well. So that's been a key element. And on the slide, a couple I'm going to read out. We've done nearly 500,000 Support at Home budgets calculated as part of the transition. We've published over 400,000 Q&As, as many of you know, for developers and providers on HPE resources. And we've also hosted 25 software developer webinars. And we've taken a lot of feedback from those, from a lot of software vendors, and things have changed and been developed on the way. And one of the things that we did do, it was late in the piece, but we did, through a lot of the feedback we got, implemented a mechanism for some testing to be done for those using the CSV option. But we are live with the system now, and so far that has been going really well. We'll move to the next slide. And this one covers our focus areas at the moment, or priorities. So we are working through processing all of the October home care packages that come through from providers, and they are our priority. So that is a key focus. We also will be continuing to transition the home care account and unspent funds budgets to the Support at Home budgets as a part of the transition. I have talked about the soft launch that's on this slide, which is the testing that we've been doing with a number of our vendors. It's going well. We continue to monitor and stabilise our system and performance, and we do work very closely with our service delivery colleagues in relation to incoming work and calls, and ensuring that we're managing any feedback and experiences that our staff have, as well as those that are provided through our communication with software vendors and advocates. So we're continuing to provide support to software developers, and we did run a webinar last week, if I remember rightly, and we continue to support one-on-one and when queries come through to the agency to support. We are also supporting the aged care sector through specialist offices and tailored communications, and that is continuing. And we are updating that along the way as we get feedback. Once you have lots of people reading material, you do get feedback on how that can be improved, and we do that along the way as well. We are continuously responding to any escalations or issues impacting the sector. And through our service delivery colleagues. So we also have a response room like Department of Health, and we are linking in with the health response room as well, and very connected, working holistically with any issues. And that's my update. I think Brian did a call out. I do want to have give a call out to all the software vendors that are with us today and people in the sector. I think we've worked very closely over the last year. You've definitely asked us a lot of questions, and that helps us with what we actually provide for Go Live and the support we provide to our providers and software vendors in relation to leading up to the change, but also post the change. So I want to thank the openness and transparency of everyone that's worked with us over this period. Thank you.
Thanks, Kathy. We really love having you join us here. I think our audience does too. It's one place where they can come and hear from all of us in government. So now it's my turn. I thought it was really important, though, that you actually heard all the status information around all the relevant systems and policy work and all the implementation that we did to get the new Aged Care Act and Support at Home up for the 1st of November before stepping in to showcase a bit of a year in review. As I mentioned earlier, it's been one of the biggest reforms the sector has seen, and it's the culmination of the efforts and collaboration of many people. And it's not the end, and we'll continue to be here during the process of a continuous improvement and the staged implementation ahead. But I did want to showcase and the engagement map for the year, which to show how much work has gone into making sure that we stay connected with you guys. And we achieved a lot together. So across the top of this diagram are all the tech talks that we have. We ran 8 public tech webinars this year, including today's, averaging a tech talk every 6 weeks or so, give or take. We get approximately 800 attendees per session in a live webinar, and those big blue bubbles kind of give you a sense of the numbers. That's over 5,000 people engaging with us online in these events, and it doesn't count those that look at the recording later, which speaks to the commitment and the interest that we have collectively together and committed the sector to the digital uplift. You can also see on the bottom part of the image there, which is our sector partner group, which is a smaller group. It is the volunteer group that runs hand in glove with the Tech Talk series. But that sector partner group meets every fortnight with us so that they can assist in co-designing the digital solutions that we build. It's a smaller forum, but we held 21 of these sector partner meetings this year, featuring 23 individual design project activities where we sought guidance and information. So if you're looking for a way to be actively involved in the work we're doing, I'd encourage you to volunteer in that sector partner group in 2026. The third kind of imagery in that is also, which is the yellow single tooths along the middle, is actually the guest speaker series that we do, where we get invited to speak at hosted events. And as you can see, we're pretty active. We've done a lot of the yellows in there, and I've set apparently a personal record of 13 conferences appearances this year to make sure that we're getting the information out. I think Brian, Janine, Emily, Andrew, everyone's also done them. So a big thanks to them. The red ones are actually our regional representation and remote engagements. So we made a big conscious effort to this year, leading up to the 1st of November, to reach out to those really hard to reach audiences that maybe don't have the time to attend these things. And so we sent our staff on the road to present at the Rural, Remote and Regional Services Development Assistance Panel. These were workshops that more recent aged care manager training workshops where we hit every state and territory. So from the top of WA into Broome, across to the Northern Territory, into Darwin and Alice Springs. We went far north Queensland down to the east coast, including Dubbo and Shepparton, across the ocean to Tasmania, and let's not forget the port cities in South Australia. So we've built really strong relationships in the regions and gathered critical insights in the experiences of those areas, and they found the workshops really valuable because we brought digital to them. An aged care reform certainly changed the way we work here in the sector with you, with the sector engagement team responding to many, many questions over this time, more than ever. Since June, we've answered well over 330 inquiries just through the sector partner and Tech Talk community alone. This doesn't count all the other questions that have come from other areas. And it's hard work in the background, making sure that we provide all the information and point you to the right resources. A huge thank you to the team and to all the subject matter experts who contributed to this effort. Reform also had an impact on the sector partner group, which saw a massive growth of 184 new members this year. Inducting them, going through all of that, that was, no small undertaking. This group started from very humble beginnings with only a handful of people at the beginning, and now has a significant presence and representation across the aged care sector, all through providers, software industry, academia, just so many different personas come to that group, something that Janine and I are very proud of. We'll also have some great collaboration with our partner agencies, Services Australia and Commission, something we continue to grow and bring together to assist you guys where we need. I won't cover this one too much, but Brian did talk to the fact that in his review and highlights that our technical delivery earlier, he talked to that, but I just wanted to showcase some of that work that Brian and the team have done. 3 major releases, often with, other releases every other month where we might have done some patches. Like he said, well over 60 major system reform changes, impacting all external stakeholders, not to mention many more that we released on our internal systems. We validated and tested over 19.5 million records and processed 5.3 million across data warehouses and through data migrations. We had approximately 600 people working on call or over the weekend release to execute a roadmap with it was like a 7 streamed complex change of releases. So they worked really closely across the board with the sector as well. With the November release testing, which had 100% pass rate. I think you remember Brian talking to the fact that we had 25,000 test cases that we wanted to get through. A lot of work goes in behind the scenes, and our teams have been working tirelessly this year. And I know you guys have too. And like I said before, it's a culmination of a lot of people's efforts to bring all of this together. And I'm extremely proud of the team. Finally, as we wrap up for the year, I'd just like to remind everyone that the online resources collections are still active and they continue to be a good source of information. Although the pace of change and additions has slowed considerably, new or updated information is always in these collections, so have a look. These are the collections for Support at Home, B2G, My Aged Care and GPMS that have had some recent changes. And I think that's everything from me, and I'll hand back to Janine so we can look at any Q&A that you guys might have for us.
Thank you, Faye. As I mentioned earlier, I'll be moderating today, so we'll start by bringing our panellists back to stage. So Faye, nice to see you. We'll welcome back Maria, Brian, Kathy and Catherine. And can we take our slides down just so we can see everybody who's on the panel? That would be great, team. Thank you. Also, just a very quick acknowledgement to our SMEs and standbys who are waiting in the background, providing answers to the questions so we can answer as many in room as possible. There's plenty of expertise both on screen and off today helping us to get through this Q&A. All right. So we'll start off with a question for Maria. Welcome, Maria. This question is from Natalie, and the question is, will there be bulk upload available for uploading associated providers to GPMS? This would be highly beneficial for providers.
Thanks, Janine, and thanks, Natalie, for your question. So bulk uploading is not currently available. The Commission and the Department are looking at options to help providers manage large numbers of associated providers. We will provide more information and guidance about this as it becomes available.
Great, thank you. So something we can look forward to in the new year. Excellent. Okay, question for Kathy. Hi, Kathy. This question is from Natalie. And the question is, are there any contingency plans in place from Services Australia for November claiming should APIs not work as expected? I understand testing has been successful. However, live environment and provider claiming at once is potentially a risk. what plans do we have in place if
Yeah.
they hit troubles?
Yeah, thank you. So we do have claiming options. We have 3 options for claiming for providers as a part of business as usual. So one of them is the API option. We are live now, and I think we're in week 3 post go live, and we know that those claiming APIs are working and the payment APIs. So if there's any issues with particular providers, we're happy to provide any troubleshooting support for them individually. If the APIs don't work, there are 2 other options that are available, and one is the CSV option with this it's pretty much uploading a spreadsheet, or it's the manual claiming via the aged care provider portal, and all of those are currently available as options for providers to make claims, and they are all working. Our business verification testing has been on all of those options. If those options weren't working across the board, there are other mechanisms to make payment that we would negotiate with our health colleagues. But at the moment, we do have those 3 options available, and all are working in the live system.
Great.
Thank
Thanks
you.
very much for that, Kathy. Cheers. Okay, next question back to Maria. This is an associated provider question as well from Nicole. And she asks, when will all the associated providers that were uploaded into GPMS portal before 17th of October be visible in the new GPMS?
Thank you. If you successfully submitted a notification via the GPMS portal prior to 17th of October, your notification will be processed. However, changes will not be immediately visible in GPMS for registered provider. So due to an unexpectedly high volume of notifications submitted prior to 1 November, there is a delay in processing these notifications and these changes being visible. So we just ask, please be patient and don't resubmit, and they'll be processed shortly. Thanks, Janine.
Great, thanks, Maria. So we'll just note that they're not too far away and give them a little bit of time to catch up on the volume. Thanks. Faye, we've got a question from one of our regulars. George Magellis, Dr. George Magellis is dialing in. George works in the Ageing Australia organisation, but right now he's currently in Hong Kong. George is known for calling in to visit with us from Greece and London and all over the place. So today he's calling in from Hong Kong, and George asks, well, first of all, a comment. He's saying that at the summit he's at in Hong Kong, there are they're very excited about Australian reform and lots of new innovation here. And he asks, now that we have solved aged care legislation, what are the plans for supporting Australian innovation in aged care, and how do we get to the next stage? Faye, I might let you start this one.
Thank you. And George is very committed. Yes, I don't think he's missed a tech talk really. It doesn't matter where he is in the world, he dials in. So thanks, George, for your commitment. And work on the aged care data and digital strategy continues with a focus on innovative and best practice enablers for this sector. In my role as CDIO, we're working also within DHDA to implement a new digital strategy, a unified digital strategy that kind of anchors all of the different strategies we have across the department and government, and also develop a 10-year investment plan, which starts to take some of the lessons we've learned here over the last 4 years in aged care and build them and integrate them more broadly to the other areas of health care and the support economy. So really looking forward to that. We've just internally kind of started with our first Digital Futures Directions placemat. And hopefully we'll be able to show that to you in the new year very shortly. And then from there, we work out, what are some of those core capabilities and platforms that we need to create a better connected and automated ecosystem between aged care, disability care, the broader health, allied health, veterans care. How do we get the care economy together? So I guess it's watch this space, which is why I paused to reflect on the year we've just had, as this is our last Tech Talk. And I look forward to putting some new goals and challenges on the table for us collectively next year.
Thanks very much, Faye. And just as a bit of a teaser for next year, we do have Josh Molden coming back to talk to us about the aged care data and digital strategy. So stay tuned for that. Great. Next question is from Rui, and we'll put this one to Kathy if we could. In the aged care provider portal, under the correspondence search function, when searching correspondence letters, the results are currently restricted to a maximum of 50 items displayed. Could you please advise when this functionality will be updated to allow more than the 50 results? As you know, during the monthly review, correspondence letters generated within the same day can exceed 50, and this limitation impacts our ability to complete reviews efficiently. Kathy.
Thanks, Janine. And I do want to say thank you for the suggestion from the person that suggested it. We are always looking for ways to streamline the services and make things simpler to the sector. So we will take that suggestion away and work with our technical colleagues and keep this network updated about when there is scope for us to actually enhance that in the future.
Thanks, Kathy. And you're right, that's the magic of these sessions where the developers and the users can get together and actually figure out the practical solutions that make things better. That's awesome. Okay, the next question's for you as well, Kathy. We're still waiting on a few answers from Services Australia, which will be key to submitting claims on 1 December. How do we access testing for the CSV upload? How do we claim the tail off of October claims? Can we simply submit another claim for October? I've looked and asked around various forums, but don't have answers. Kathy, can you help Diana with that question?
I can. So just the first part of the question, which is around help with testing. We continue to provide support to software vendors who are having any queries or support they need to do their testing in preparation for the systems being live at that end. If there is something that's outstanding from that, we do have that developer liaison at Services Australia mailbox where if you need to seek help for that, we can provide that support. So feel free to write to that mailbox about anything that you're finding in testing that you need support with. On top of that, the question was around the claiming. So once the final October home care package or program claim is submitted in November, you will not be able to do a further claim under the home care program. So because we're transitioning to a new claim process with support at home. So once you've submitted the October claim, you will then have to, if there's any corrections that need to be made, they will be through Services Australia, the existing adjustment process that we have to make any corrections. My words aren't coming out right. So there is a standard business as usual process for that as well, where if you need to correct claims that have already been submitted, you can submit that request to Services Australia, and we will then support you with that correction to that previous month's claim.
Great. Thanks very much, Kathy. Okay, the next one's a SBA question as well, and I might throw this one to Catherine if that's okay. We'll shake it up a little bit. So this question is from Marianne, and it is, will we be able to receive the fee letters via email, please, rather than having over 500 documents posted to us? Catherine.
Thank you. That's another great question. And look, what I am able to advise is that Services Australia actually makes provider letters available via the aged care provider portal. So that is an option to be able to make that easier rather than receiving them via that mail option. So very happy to report that that functionality is already there to view those letters in the portal.
Great.
Thanks, Janine.
Cheers. And the next question is, where can providers see their care management account balance in the ACPP portal? And that's an SBA question as well. I'll let Catherine and Kathy decide who wants to jump in for that one.
Again. Yeah, I'm ready to go.
Sure.
So providers can navigate to the current budgets screen in the aged care provider portal via the menu, budgets, current budgets. And then that will display the care management budget in the service provider budgets table. The screen also displays care recipient budgets for view. So that was via the menu, budgets, current budgets in the aged care provider portal.
Excellent. No worries. Thank you very much for that, Kathy. Bit of IT support there, which is good. And then question for Brian. Hi, Brian. This one is an anonymous question. When can we expect to see more details on the roadmap past February?
I think at the moment we're in the final stages of scoping up those releases. So I'd expect early in the new year, probably at the first Tech Talk when we come back after the break, I'd expect we'd be able to have an update with some details at that point.
Great. Okay, so I'm guessing we'll be getting right into that in our first Tech Talk for next year. So stay tuned, everybody. No doubt we'll have Brian back to give us the highlights. Okay, I will just do one last refresh and see if I do have an additional question. So this question's from Alice and it's for Maria. How do I upload an associated provider who wasn't submitted before the 31st of October using the old GPMS? So if they've got associated providers they need to upload, how do they go about doing that now?
Yep, you can do this using the smart forms available from the Commission. So we can share the link to that in the post email after the event.
Great.
There's a change in circumstance form available from the Commission's website.
Excellent. And if you want a little bit more information about that, we did have Luke Steins from the Commission doing a bit of a preview of those smart forms, a couple, I want to say 2 Tech Talks ago, but maybe it was one. Time flies when having fun. Was it one?
Yeah.
Yeah. I'm losing all loss of sense of time. Yeah, so if you are keen to get a deep dive into that, just go back onto our YouTube channel or onto the departmental website and you can check that out in detail in one of our last Tech Talk. Okay, and a question again for Kathy. So this one is, we have clients that have exited HCP pre-1st of November 2025 who have CW unspent funds to be returned. When attempting to do this on the portal, the system won't allow the entry indicating CW unspent amount cannot be after the October 2025 claim approval. If this is making sense to you, Kathy. Will this be rectified as we have a number of opt-out clients who exited before Support at Home started? And that question's from Marianne.
Yeah, thanks, Marianne, for the question. And we are aware of it is an issue at the moment in the system in production, and we're working to resolve it as soon as possible. We have targeted a fix for early next week at this point, and our fixes generally are going in on a Tuesday evening. It is suggested holding off until after that, just so that we can put that fix in, and then hopefully post-Tuesday, we should have that resolved.
Great.
For that cohort. Yeah, but
Excellent.
Thank you.
Yeah, thank you very much, Kathy. To my team, it just occurred to me, if we can put the link to Luke Stein's smart form presentation into the post-event email, that'll give people quick, easy access to the information about those smart forms in case there's other people who want it. Panelists, we had about 5 additional questions that we do need to take on notice. So for those people whose questions we didn't get to, apologies, but we will take those away and make sure we look for answers for you. And I think that means the rest of our panel can bid us farewell. Thank you all for your time and for your presentations today. As always, it's so great to have representation right across the suite of work we're doing in government to drive aged care transformation. Thanks so much, guys. Big thank you to Brian, Maria, Kathy and Catherine, and all of our presenters that have come to Tech Talks in 2025. We are actually running a little bit ahead of time, Faye, so this is also a bit of an unprecedented outcome for our Tech Talks. I'll get the team to, if we can get the slide deck back up on screen, that'll be a wrap for our Tech Talk for today. We'll say farewell to our panelists and thanks again. Okay, so as always, we love to hear your thoughts in our post-event survey. Please don't be shy. We love your frank and fearless advice, positive and negative, all welcome. We're currently finalising our dates for Tech Talk webinars for 2026. We do have the release in February, so you can expect to be hearing from us before then. When our upcoming webinars are open, the registrations will be available on the web as usual. You can use the QR code on screen or the URL in the list of links to access that registration page. And as soon as we know the date, we'll put it up onto that page on the web. I wanted to just very quickly take a moment to say a big end of year thank you to my team who helped drive our engagement efforts with the sector. They are a really smart, dedicated, funny, warm bunch of people whose hearts are in the right place in making meaningful reform for the community and who are really invested in aged care. I super appreciate you guys. You work so hard, and I want to just call you out for a special thank you. I also want to say from me to our audience, thank you for sticking with us. This has been a really big year. You share your time and your expertise. You bring that frank feedback and your advice and expertise to these forums. You make our products better. I lastly just wanted to say a big thank you to Faye for your commitment to the sector and also to engagement, something that is very dear to my branch's heart. It makes a big difference, I think, in how people can understand what's happening across the digital transformation roadmap and really have a chance to influence it with the knowledge that they have from the ground. So thank you, Faye. And with that, back over to you to take us out for 2025.
Thank you, Janine. And I know it's a bit of a love-in today, but I just think it's the last one for the year. And it's a big shout out to you and the team. And thank you, because the logistics that go into running one of these events is massive. So a big thank you to you as well. I'd like to thank everyone for coming today. It's been quite a journey. I call it the transformation for the nation. Together we've been pretty brave and bold, and we're moving the dial and making a real difference. If I look at where we started 4 years ago, I'm actually doing this event today live from the MSIA conference, and they're out there, and I've popped into a room. And, we were talking about just actually how aged care has actually moved the dial and leapfrogged in front of other areas of the sector in health. So congratulations to you all. I want to wish you all happy holidays. I hope everyone gets time to take a bit of a rest and connect with family and friends and really enjoy that holiday season. And I look forward to seeing you all back in 2026. So have a happy new year, and we'll see you then. Bye for now.